欢迎参加国务院联防联控办的新闻发布会。近一周，周边国新增确诊病例数继续，我国外防输入压力持续增大。当前，
Friends from the media, good afternoon.
仍有发生。
Welcome to the press conference held by State Council Information
疫情扩散风险持续存在。
Right now, we have seen a rapid growing of the confirmed cases number, and we're still facing a surmount pressure of preventing the imported cases, and we have also seen the increasing number of cases domestically. And right now is the time for recovery, the resumption of work after the holiday, so we need to stick to the principal policy and should never lower our guard against the coronavirus and make sure all the measures against the virus is implemented in full and correctly. As of the vaccination, as of February 18th, so far we have registered the 3.07575 billion doses, and more than 1.2 people finish their 2 doses of vaccines. Today, we will continue to talk about the various prevention and control measures as well as vaccination. With us, we have Mr. Wu Liangyou from China CDC and also Madam Guo Yanhong from China Health Commission and also Mr. Shao Yiming from the a group of vaccination of the Joint Prevention and Control Organization, and also Mr. Wang Huajing from the CDC. And now the floor is open. Please raise your hand and also please identify your media affiliate before asking questions.
谢谢您的提问。目前呢，我国本土疫情形势总体保持平稳。
CMG CCTV. I would like to ask for the overall picture regarding the current coronavirus situation in China. Thank you for your question. The overall situation is stable. The Baise in Guangxi Autonomous Region right now coming to the tail part to clear the confirmed cases number, and the Huludao in Liaoning province. And all the cases right now found in the quarantine places, and right now the curve is flattened. And Heihe of Heilongjiang, the situation is located in Heihe, and have seen the several routes of infection are now under our research. And in Guangdong province, we have seen a cluster of the confirmed cases triggered by the imported cases. And Shenzhen, right now the curve is flattened, and Dongguan right now is under the work of investigation. Honghe, Ruili, Yinshan in Yunnan province, right now we still try to figure out exactly the source of infection and also accelerate the route of infection, make sure that there's no spread from the border area to the city. And Jiangsu, that's the case triggered by Omicron, and that's caused by the imported cases. Right now, we're still seeing the rapid growing of the confirmed numbers. Right now, Jiangsu is doing all out efforts to conduct the testing as well as to screen out the close contacts and the potential confirmed patients, make sure that we control the spread of the virus. Inner Mongolia is the case triggered by imported cases. That's a Delta variant. And now Baotou in Inner Mongolia is the place of the cluster cases. Right now, still at the early stage of a round of infection, and we have found a cluster of infection happened in the group dining and also a wedding ceremony So right now, the local authorities doing everything they can to screen out the close contacts to control the spread of the virus. Right now, a specific working group sent to Liaoning, Inner Mongolia, and Guangdong province work with local teams to deal with the local outbreaks, make sure that all the measures are implemented. And right now, still is a time of the back to school. So we will put a very close eye on the disease prevention and control work. Make sure that the flow of population is in a well-orderly manner. Thank you.
问当地的这个医疗救治情况到底怎么样，有什么特点？另外，我们也知道广西百色呢，它地处我国的西南边陲，的救治水平能不能满足当地的这个
China National Radio.
好，我们请郭艳红。
As you mentioned, the Joint Prevention and Control Mechanism actually sent team to Baice in Yunnan province, and as you mentioned, right now coming to the tail part to clear the confirm the cases. I would like to know that what's the current progress and whether the local resources are full enough to deal with this round of outbreak. Thank you for your question. Yes, we sent a group of experts to the front line to give the help and guidance to Baice. And also we have sent experts at the national level with this working group to help Baice, working with the local experts to allocate the resources of the medical support. Talking about the patient, on the 5th of February, the hospital in Baice received the first case in hospitalized. So far, 272 patients have been treated in the hospital. And 4 developed to a severe situation. Right now, we have seen 2 out of 4 right now from the severe to the moderate situation. We have referred to the previous proved KDA measures, make sure that we move ahead of the curve, and also to use both Western and traditional medicine. And the expert team from the national level to the local level all work together to provide a patient-specific treatment plan. And during the treatment, for the patient with high risk of developing to severe situation, we provide the early warning system to these group of the high-risk group of patients, especially the elderly people with underlying diseases. So we put a very close eye on them and also give them more nutrients. Regarding the allocation of medical resources, from last year to this year, we have seen the different localities actually invest more to the designated hospitals. Talking about the situation in Baice, actually that's the place called Debao. That's a border place. So, although that's a border city, the southwest place, but they all have quite good facilities. They prepared nearly 900 beds dedicated for treating COVID-19 patients. And the Guangxi province also dispatched more than 1,000 medical staff to station at the designated hospital, and also based on the dynamic situation, they also sent more nursing staff, as well as the pediatrics, as well as the professionals from different medical departments. So we talk about that from the head count to the management. These two designated hospitals in Baice of Guangxi province doing a good job, and also with the sufficient supplies. And also at the same time, we also ask the local authority to make sure they also meet the needs of the hospital service of other patients. So far, we have seen that 30 patients have been treated and freed from the hospital. Thank you. Xinhua News Agency. How to better leverage the role of a vaccination? Right now it's under discussion. And we would like to know about the booster shot. Right now, we're still under a big pressure of preventing the imported cases and further spreading domestically. And we have also improved our plan of vaccination in light of the dynamic changes in the COVID-19 situation.
18岁以上目标人群可以进行一剂次同源加强免疫，也就是用
Talking about the vaccine.
续贯加强免疫策略实施后，完成全程接种上述3种灭活疫苗的目标人群，还可以选择自非农科码的重组。
We talk about a booster shot. So basically for people, after they finish their second jab, and after 6 months, and also they should be above 18 years old, and they can receive they are eligible to receive the booster shot from the same vaccine provider.
灭活疫苗的同源加强免疫接种，无论是同源加强还是续贯加强，都是在完成全程接种满6个月的18岁以上人群中实施。研究数据表明呢，同源加强免疫和续贯加强免疫都能够进一步提高免疫效果。希望满足接种条件的人群。
Talking about the boosters, you need to first meet the requirements. You finished your second jab for more than 6 months, and second, your age above 18. And for the booster shot, it provides the additional line of defense, and also call for everyone to receive your booster at an early date, in order to contribute to your strength against COVID-19.
好，谢谢这位记者的问题。正如由于我们国家这个
CMG
疫情防控做得非常好，我们在国内查这个不管是
like to know about the safety and effectiveness of
有
booster.
些困难的，但是我们在国内也开展了很多的真实世界研究，比如说近期我们在山西、河南、天津等地呢，就进行了在德尔塔变异株 流行又有奥密克戎变异株流行的地区呢，开展了
Thank you for your
分享
question. Indeed,
那么此前呢，在我们国家也发生了在广东、江苏、福建
right now we
内部
have
地
doing
呢
a quite solid
完全是
work
德尔塔
in
变异
the
株流行的
controlling the
这个
spread of the
疫情
virus.
那么目
And
前已
also
经有
right
的
now
一
we
些
have
研究结
seen
果
the
呢，可
a
以跟大
cluster
家
of
分
the
享。
cases. That's
呢
for us to conduct
近期
the
山西
a
疫情
research
报告
on
的
the
有
effectiveness
2000 多
of
例
vaccine.
这个感染均为德尔塔株感染的。
And before
这个发
that's
生
the
率呢
a
大概是
Delta
2%。
variant.
那么郑州
So
和
far
许
we
昌两地
have
的疫情
reached some results.
这个感染者呢，那么它是499例，也均为这个德尔塔株，重症发生率呢是3.4%。
And in
在
Shanxi,
这
there's
些
around
具体性疫
30
情的处置过程当中呢，
cases caused by
管控措施和治疗
Delta
手段呢都
variant
是相近的。那么唯一的一个主要的变量就是疫苗接种率在不同时间它是变化的。那么
in Shanxi, that's
这说
around
明呢，
499
通过
cases
这个疫
also
苗
caused
接种
by
率的提高
Delta.
可以使感染德尔塔变异株的重症风险呢，较之前呢，
The a management
从之
or
前
the
的平均
lockdown
7%能下降
measurement
2
and
到
also
3倍。
the
所
a
以说呢，
treatment plan
这个
are
疫苗的效果
identical.
是
The
显
only
著的。
difference
另
is
外呢，
the
我
a
们还有去年
vaccination
5月
rate.
在广东的这个德尔塔疫情为例，这次报告是190
And
例
by
这个本土
comparing
传播的
the
病例，接种过2剂次疫苗后
rate
呢，发展
of
为这个普通型
severe cases, we
重症
can
型
see
的风
that
险，较
the
未接种的这个
vaccine
疫
can
苗
help
下
to
降了
lower
5.9
the
倍。
rate of
去年发生在
severe
江苏的疫
situation.
情
And
呢，
also the
也
case
是德尔
in
塔株，
Guangdong,
共
it's
报
a
告感染
90
是
confirmed cases.
1300多例。那么其中全程免疫的感染者呢，仅5例发重症，占所有重症病例的只有5%。60岁以上重症呢
And the
97%呢，
rate of developing to severe cases or the moderate cases actually lowered
那么重症呢
by more
全
than
部发生在
5% compared to
这
the
个
people
没种疫苗
not
的。
receiving the vaccine.
此外呢，广州的这个疫情分析数据呢，也表明接种疫苗后再感染者的这个，也就是
And
突破
we
性
found
感
that
染
in that
在密
plates
接人群当中的
that the
阳转率
a
显著高
confirmed
于未
patients
接种
age above
疫
60
苗的这个密切
as the majority of the cases, especially the cases developed to severe situation, that's the
在春节
person
前，
not
河南
receiving
许昌
vaccination
疫情的
or
分析数
people
据
not
呢，
finishing their 2
加强
jabs.
免疫后呢，突破感染的病毒载量呢，仅比这个免疫的这个要低2到4倍。以上数据都表明，对于德尔塔株，我国新冠疫苗加强免疫后，对预防感染和再传播呢有一定效果，对预防肺炎和重症呢有显著的效果。那么第二呢，是今年1月20号，天津呢，截止到今年的
For
1
all
月
the
20号，
A
天津和
numbers
安
we
阳
have,
疫情共报告感染者是
the
759
vaccination
都
is
是
the
奥密
a
克戎的毒株。
efficient way
那么，仅天津出现4例重症病例呢，安阳传播链呢
to
没有出
protect
现
people,
重症病例。
especially the people
那么
developing
重症
to
发
the
生率
severe
呢，大约只
situation.
有
And the
0.6%。
situation in
这
Tianjin
说明奥
Anyang,
密克戎变异株本身引起的症状是比较
759
轻的。
cases
但是我们通过研究还
reported
是发现，
due to
完
Omicron
成接种免
variant
6个
in
月内
Tianjin.
可以使新冠病毒感染者发生肺炎的风险呢降低
And
60%。
Anyang, we have found that
在密接人
the
群中的
a rate
完
of
成接种
severe
免疫加强
case
免疫
just
的突破感染率呢
0.4%.
分别为
And
6%和
one thing that
6.0%。
tells us that the a Omicron vaccine is not the a contingent compared to other variants, but that also tell us, based on the a data, we have found
就这些数据都表明，对于
that
奥密克
the
戎株
a
我们国家的新冠
people
疫苗呢
received
是能
a
够降低
vaccination,
发生肺炎的风险的，进而
and
可以
also
减少
people
重症和
received
死亡的发
boosters.
生率。我们国家新冠疫苗的加强免疫
So booster actually can help lower
突破感染
the
具有
case
抑制
of
效果，可降低奥密克戎
infection
的再
by
传播
3
能力。
times.
所以说，
All these numbers tell us that the vaccines and also the booster shots are the effective way.
谢谢你的问题。好，谢谢，请继续提问。
To lower the
好，我们先来请
spread
座
of
次是
the
第三排
Omicron
韩
variant
国到第一位记者。
and also the current vaccine is still
你好，
effective.
财经杂志记者提问。刚才听到说我们目前我国已经启动了新冠疫苗
Thank you.
序贯免疫，然后还想请教什么是序贯免疫，然后往有序贯免疫程序再应用吗？谢谢。
请王华庆先生来回答这个问题。
好，谢谢记者提问。其实新冠免疫这个概念呢，关注的一个概念啊，也是最近比较热门的一个。新冠免疫呢，实际上，在过去，这项免疫策略，它是呢技术路线的疫苗，按照
Thank you for your question.
时间间隔，还有呢这个接种的剂次，为了进一步呢期望提高这个保护效果，同时呢也要考虑它安全性，所采取的一项免疫策略。
We talk about
那么
that
这
the
个新冠免疫呢，实际上也是我们免疫策略不断完善的一个过程，它也是呢基于科学证据基础上呢提出来的一项决策。
different
以前呢，我
the
们说到这个新冠免疫的时候，其实最早出来这个概念
vaccine
主要是过去的
from
时候
the different
我们
approaches.
应用疫苗的时候，最早我们应用的脊髓灰质炎疫苗呢是减毒活疫苗，也就是大家说的那个小儿麻痹、糖丸。全程接种下来呢需要这个4剂次。那么现在呢，我们使用的这个疫苗呢，也是完成4剂次，但是前2剂次呢是用这个灭活的3价脊髓灰质炎疫苗来进行接种，后2剂次呢我们用这个2价的减毒活疫苗来接种。那么在制定这个新冠免疫策略的过程中呢，其实我们一方面呢考虑它的保护效果，另一方面呢像脊髓灰质炎这个疫苗。
As we talk about for the COVID-19, so that's the
进一
sequential
步降低严重不良反应的一个风险。谢谢。
好，谢谢。
immune
请继续提
plan
问。
and including 4 jabs. So you need to think about that the effectiveness.
谢谢主持人。人民日报记者提问，我的问题是，请问如果我们希望接受
And that's also a way to help to lower the
谢谢。
happening
好，我们
of
继
the
续请王华
adverse
庆先生来
effect.
回答这个问题。
好，谢谢这位记者的提问。其实新冠接种呢，有一些特别的注意事项。
People's
其
daily.
实有一些呢，刚才那个吴良友局长呢已经讲到了。
If we like to receive the
我
sequential
们国家不管是疫苗管理法也好
vaccine,
还是
what
疫苗
kind of
监
the
规范
thing we need
对于
to
接种呢
taken
都有
care
相关的
about?
规定。那么关于这次
For the
新冠免疫
sequential
项呢，第一个是18岁以上的人群，第二个
vaccine,
就是说他要完成2剂次的灭活，而且这2剂次灭活接种呢，刚才这个吴提到了，一个呢就是接种
we have specific
中国
the laws and regulations in terms of sequential inoculation. So that first you need to be above 18 years old, and also second you need to finish your
第
2
三个呢就是
jabs
说要全
of
程完成
vaccines
2剂次的一个接种，而且呢。
and that 2 jabs need to be the inactivated vaccine.
间隔呢6个月这样一个时间。第4个呢就是说他没有接种过加强免疫，也就是第3针没
So that showed from the
要
Sinovac.
严格呢把握这个接种的对象。那么还有一些其他事情，其实跟其他
Or the
过去
Sinopharm.
接种新冠疫苗
And
和注意
also
事项
that
是
you
一
need to
样的
wait for 6
包
months
括呢就是说
after
接种
you
之前
receive
呢
your
要
second
了解
jab.
当地这个接种
And
的
also you
相关
not
规定
you
因为
have
现在还
haven't
是
you
疫
have
情的一个流行
not
期嘛，
received
那么在这个
your
过程
third
中大家
jab.
去接种疫苗的时候呢，要做好这个个人的防护，包括在接种的时候呢，要把自己的健康状况呢，如实的呢向我们接种医
For
生
the
汇报
other matters need attention. Actually, that's more or less the same.
他是不是有紧急症？
So right now
还有
still
一些缓
is
动
the
的
we have seen the
那么最后呢，也
sporadic
提一下就是
cases. So you need to still follow all the do's and don'ts as we have announced many times before. And also, if you have any the underlying diseases, you also need to notice, report to the doctors before
谢谢，请继续提问。好，我们来请右侧
vaccination,
第三
and
排
also need
第
to
三位穿灰色衣服的女记者。
that stay there at the vaccination place for 30 minutes for observation. And if you show any the adverse effects, you always report to the
我们
vaccination
还是
station.
请王华
Thank
庆
you.
先生来回答这个问题。
这位记者的提问，实际上呢，我们
Phoenix
全球
TV.
接种的新冠疫苗技术路线呢还有很
A question regarding the practice of sequential vaccination, whether that's already a practice in other countries, and what's the view from the
欧洲
World Health Organization.
他们呢已经开始实施了这个新冠免疫。
We talk about actually for the vaccines, there are a lot of available vaccines based on different approaches.
同源接种也好，还是我们医院接种，或者说 新冠免疫接种。
North and South Americas, in European countries, and ASEAN countries. Right now, they have already started the sequential vaccination, and also WHO also support the frequent
目前我们
approach of vaccination.
新冠接种的时候，它的免疫原性或者它的有效性不低，或者说呢要高于同源接种这样一个结果。另外一个呢就是说
And also for any country, if you start
建议呢可以采用呢就是说由于首剂次不同的
the sequential immunization or sequential
当然呢它也在进一步强调
vaccination, you need to first have sufficient data and to approve the effectiveness.
完善包括我们同源
And you have a solid ground
这些策略。谢谢。
to support you conduct the
谢谢
sequential
请继续提
immunization.
问。好，我们来请左侧区第二排第二位穿粉色衣服的记者。
And WHO right now also collected the clinical evidence to improve the sequential vaccination.
预防春季新
Thank
冠
you.
和其他呼吸道传染病同时爆发。谢谢。
好，我们请吴良友先生来回答这个问题。
谢谢这位媒体朋友的问题。当前奥密克戎变异株已经成为我国境外输入和本土疫情的优势毒株，其传播力更强，传播速度更快。
From CMG
我国发生
and
境
how we
外输入疫
identified
情
the
和本土疫情风险
cold in the
大幅
spring
提高
season and from
与
the
此同时
COVID-19.
虽
And
然
the
目前我
Omicron
国南北方
variant
省
is
份
the
活动水平
dominant
有所下
vaccine
降，
caused
但
the
能促
domestic
高
spread
发季节，
with faster
随着
spreading speed.
加上学校、托幼
And
机
we
构、
also have seen increasing pressure
新冠肺炎
on
和
preventing
流
imported
感、
cases.
手足口病等常见多发传染病在局部地区，特别是在人群聚集的
Right
场
now,
所
we're still in
发生
the
叠加
high
流行
season
的
of
风险
influenza.
持续
Right now,
地存
spring
在。
has arrived.
国
And
家卫生健康
also,
委
on top of
指导
that
各
is
地
the back
在
to
做
school
好
season.
新冠肺炎疫情防控
So
工作的同时，
influenza
始终坚持多病共防，强化监测预警，规
COVID-19
范
and
疫情的
hand,
处
foot, and
置，
mouth disease
广泛开展宣传
still
工作，
have the
坚
risk
持
from
综合
happening.
防控秋冬季和
The
冬春季
National
的传
Health
染病。
Commission,
一是
on one
强化
hand,
联防联控，
focus on
落
the
实
disease
职责任
prevention
务
and control of
加
COVID-19.
强部门间
At
的
the same time,
沟
we
通
have
协
the
调和联防联控，明确
alarming
示范责
system
任，
of
落实
monitoring
各项
different
的防控任
diseases.
务，针对流感、感染性腹泻等学校常见的多发传染病，我们会同教育部门压实
So
学
first,
校主体责任，
different departments
落实
should work together
全无
to
检
create the
充分
synergy, and
消
also
毒
people should
的
know exactly the
传染
role
病
and
防控的
responsibility
制度，
for
做到
influenza,
责任明确、责任到人。二是强化
and
监
also
测，
for the
及时有效处置疫情，
diarrhea, and also
要
other
求对
diseases
学
quite
校、托
frequently
幼机
seen
构、
in
养老机
schools
构等 人群聚
We
集的
also give
重点
the
场所，进一步加强流感、诺如病毒、
policies to
感染性
schools
腹
so
泻
they know how
等常
to
见多发传染病的监
practice
测
the
以及
measures.
人员健康监测，做到传染病聚集性
For
疫群
schools, daycare
早发
centers,
现、早报
kindergarten,
告、早组
and
织，
elderly care.
防止疫情扩散蔓延。三是强化群防群控，提高群众的防病意识，
And they should
指导各地结合
monitor
本地区的
the
重点传染病疫情
happen
的形
of
势，
COVID-19
我们做到
and
集中宣
influenza,
传
diarrhea,
和
make
日常
sure
宣传
that
相
they
结合，
report the case at
全
early
方位
time.
是的宣传普及东圈
Third,
剂的传染病，
We
知
should
识
also
来进一
increase
步提
people's
高
awareness.
群众防护能力和及时主动就。谢
So
谢。
we educate the people.
好，谢谢，请。好，我们来请左侧区第3排第3
in
位记者。
multiple places, times, and
谢谢主持
also
人，香
different
港
ways
政府
to
社区的提问
educate
我
people
国已经出现了
regarding
几个
how to
奥密克
protect
戎疫情，
themselves,
请问这些
and
病
they
例对
also
比过往
help
变
them
异
to
株的
increase
发病
awareness
情况、
of
救治情况
visiting
如何？有
hospital
哪些新的救治
if
措
they
施？
are
谢
not
谢。
feeling good.
好，我们请郭艳红女士来回答这个问题。
好，谢谢这位记者的提问。那么，2021年11月呢，在南非首次检测到了奥密克戎的变异株。
CRTT.
那么目前呢，全球呢已经有100
So
多个国
anything
家
new and
发现
treatment plan
了奥密克戎
specific
的
for
感染病例。那么奥密克戎
Omicron
呢已经成为全球流行的这样一个主要的
November
变异株。那
2021,
么
Omicron
22
variant
年1月以来，
was
像我国
detected
天
in
津
South
河
Africa.
南的安
So
阳
far,
包
around
括
100
广
countries
西百色
found
地
the
也都呢
cases
发生了
infected
由奥密克
by
戎
Omicron variant.
引起
And right
的
now,
本土的聚集
Omicron
性
is
病
the
那么
dominant
从目前总的情况来
variant
看，
of
我们
COVID-19.
取的
In
无论是
January,
防
in
控策略
Tianjin,
还
Anyang
是
of Henan province,
措施都
Baise
是有
of
效
Guangxi
的。
province,
那么我们
this
台湾
year
的病例啊进行了
found
分析，应该
the
说呢有方
locally
面的特点。第一呢，就
transmitted
是
cluster of
更
cases
强
caused by
传
Omicron.
播速度更快。
Regarding the
奥密克戎变异株
prevention
更容易
practice,
造成呢人群的感
management
染
are
和
working,
人群的传播。通过我们对
and
现
we
有
also
病
look
例的
into
流
the
行病
confirmed
的分析。
cases,
那么，
and
奥密克
all
戎
these
感染
cases
的
show the
病
following
例
features.
间的
First
带间距平均呢为
is
3
a
天，
faster
比
spreading,
呢德尔塔变异株的4天左右进一步缩短。所以说呢，它的传播
and
能力
also
大概呢
the
是
high in
德尔塔变异株的2倍。
infectivity.
那么，所以
Based
它
on
这个传播能力更强传播的也快。那么第
Our
二个特点呢
epidemiological
就是
investigation
奥密克戎感
compared
染
to
的
Delta,
症状不典型
Omicron
因此呢，在
show
传播过
that
程当中
the
也
capability
更
of
为隐匿。从
infection
临床表现来看
has
奥密
doubled
克戎毒株
of
的
that
感
of
染
Delta
跟
case.
其他的这个病毒所引起的上呼吸道感染的症状相似，缺乏呢特异性的表现。
And also we
临床
found that the
鉴别诊
symptoms
断难
caused
度比
by
较大，那
Omicron
么
actually
病
not
毒传
typical,
播变
so
得更加
is
隐秘。
hidden.
那么第三个特点呢，就是呢，我们对这些病例的分型也进行了分析。病例呢，主要以轻型和普通型为
It
主，
showed the
那
a
么症状
normal
呢也相对较轻。
the
临床的主要表现呢，咳嗽、
reaction
胸
at
痛
the a upper
发热
respiratory tract.
部分的者呢有
Nothing
这
very
个
specific
鼻塞
caused by
流
Omicron.
涕、头痛等等这些症状。那么
And
另外
for the
患者
cases,
的这个影像
the
学的
majority
改
of
变
them
不
actually
典
the
型
a moderate
应该
or
说呢
light
总体的来
cases.
看呢，这
They
个
just
重症
show
患者的比例
symptoms
呢
such as
也不是
coughing
很高。
or
那么，但是由于它呢这
a
个传播很快，
throat
那么一旦呢造成了人群的传
and
播，
snowing
那么就有
the
可
a
能
running
造成了
noses
对医疗资源
or
的
the
挤
a
兑。
headache.
因为现在呢，我们
And
呢
also
通过
we're
4早
looking at
这个早期对患者呢进行观察、进行干预，所以应该说呢，我们整体的患者的救治这些策略呢还是非常
There
有效的。
the
所
a
以在救
image
治
actually
当
nothing
中，我们
shows
仍然强
quite
化
different.
的就是关口
That we
前
talk
移。
about that
那么做
because
好
it's
呢
the
病例
a
的分类。
spreading very
对于
fast.
轻
So
型和
if
普
that
通
we
型的
have
患
found
者，
if the
我
a
们强
suddenly
化
that's
呢
the
对高
a
风
increasing
险
number of
患
confirmed
者
cases,
相
then
应
the
预
hospital
警
actually will
指
be
标的
overwhelmed.
监测、预警。
So during the treatment, we emphasized many times about running ahead of the curve. So for the light and moderate situation cases,
营养的支持的治疗，特别是对一些像这个高龄患者，还有包
so
括有
we
疾病的这些患
monitored
者，
people with a higher risk of developing to severe situation and also provide both Western and traditional Chinese medicine, and also provide the case-by-case treatment plan for the elderly case people and also people with the underlying diseases, and we provide
左侧区第4排第3位记者。
the plan across different disciplines. Right now, we have seen all these treatment plans at the clinic level all showed effective. Thank you.
60岁以上、80岁以上的老年人目前接种疫苗的进展如何？那围绕老年人的接种，我们开展了哪些工作？未来会有哪些接种的计划？请给我们介绍。
Oriental TV.
好，我
Right
们
now, we have
请
seen
吴良友先生来回答这个问题。
more than 3
谢谢您的
billion
提问。根据
doses of
国务院
vaccines
联防
have
联
been
控机制的部署
administered. So my
目前
question
我们
regarding
继续
the
指导
a
各
group
地
of
积极
elderly
稳妥地
people
推进
and
新冠
what's
病
the
毒疫苗
rate
的
of
接种工
vaccination
作。
among these
刚
group
才
of
李
people,
副市
and
长已经
what's
介绍
your following
截
plan
止到2月
to
18
promote the
日，
rate of
全国累
vaccination?
计报告接种新冠病毒的疫
Thank
苗
you for your
达到
question.
30亿
Based on the plan of
75万
a
剂次，
joint provision and control
疫苗接
mechanism
种
of
总
the
人
State
数
Council.
达到
Right now,
12
we
亿
continue to promote
6818
the
万，
a work of
已完
vaccination
成全程
as
接种
of
人数达
February
到
18th.
12亿
The accumulated
3254万，其中
vaccination
60岁以
reached
上老年人
3.7575
新冠病毒疫苗接种覆盖人数达到
doses,
2亿1961.7
more than
万，
1.2
完成
billion
全程
people
接种达到2亿
have been vaccinated.
1072.8万人。80岁以上老年
Where
人
the people
新冠
above
病毒
60
疫苗
years
接种
old
覆盖人数为2044.1万人，
260 million
全程接
people
种
received
1795.3
vaccination.
万人。前几
202
次新闻发布会上，
2
我们也跟
million
大家介绍
people
过，
finished their
老年
2
人
doses.
感染新冠很容易发展成重症，造成生
20
命危
million
险。
people finished their
接种新冠
vaccines for the group of
对
people
于
above 80
预防
years
感
old.
染、再传播症都很有
In
很好的
previous
这个
press conference,
老年人也需要通过
elderly
接种疫苗
people
获得免疫力。
are very vulnerable
但就目
if they infected,
60岁以上的老年人，特别是80岁以上的老年人，
receiving
接种率与
vaccination
全人群相比仍然偏
is
低。
a good way to protect
我们
elderly
一直
people
高度
from
关注
developing
老年
a
人的
severe
身体
situation
健康，
or from
也希望老年人
infection.
能够更加方
Based on
便
the
地
current
接种
situation,
上
the people
新冠
above
病毒
60
疫苗
years old, especially group above 80
为此呢
years old,
各地已经
the
针对
rate of
老年人
vaccination
出台
compared
了
to
一
the
系
other
列的
age
便
group
民措
is
施，
comparatively low.
从接种点的设置
We
到
always
接种
attach
环
great
境的安排，
importance to the
从接
health
种前
of
的
elderly
健
people
康问
and
询
also provide
到接种后
convenient,
的流
accessible
光，
service of
从接
vaccination
种
to
记
these
录
group
的
of
登记
people.
到接种知识的科普，
So
方方
different
面面都根据
localities
老
have
年人特点
introduced a
做
different
了进一步
way
的
to
细化。
promote the
目的
vaccination
呢，就是要为老年人提供
for
更
elderly
好的
people
服务。
and
未来我们将继续指导各地结合
from
老年
the
人特
a
点，
place of
更有针对
vaccination
性的
to
开
the
展接种工
education
作，
of knowledge,
优化服务质量，确保接种安全。
provide really friendly
丰富
service
宣
to
传形
elderly
式，
people.
提
All
高
in all,
老
we
年朋友
would
们
like
的
to
接
provide
种意
better
愿。
service
那在
to
这里啊，也想再
the
次
elderly
提醒
people.
大家，
Going forward,
提高老年人的接种率，除了我们做好服务以外，
we'd like
各
to
个家庭的支
improve
持
the a
是
service,
至
make
关重
sure
要的。
the elderly
希
people
望
can
大家
receive their
都能
vaccination
关
in a
心
safer manner.
关爱我们身边的老年人，
I
动员
also hear
和
once
陪同
again
他们接种新冠病毒疫
to
苗，
say
共同为老年人的健康
that
保障
besides
贡献力量。
providing good service, each family also play a key role in this endeavor. And I hope everyone show your love and care to your elderly family member, and you can accompany them to receive vaccination. Thank you. 2 last questions, please.
24小时核酸检测服务。第3个是目前各个省份的核酸检测收费水平怎么样？
Guangming Daily, I have 3 questions.
我们请郭艳红女士来回答这个。
好，谢谢这位记者。
First, regarding the
就核酸检测
testing capability,
的这
and
3个问
second,
题。那么我国呀，新冠病毒的核酸检测能力
regarding
总体
the
是很强
testing
的。
service,
那么截止到目
whether
前，
that the
全国已经有
hospital, especially the hospital above class 2, can provide 24 hours service of testing. And third, what about the fee charge? Thank you for a question regarding the testing. So far, we have seen a quite strong capability in testing. So far, more than 12,000 agencies are capable to providing a testing service. So that's including the traditional laboratories, also including that's the mobile, the laboratories. So per day, per tube, 45 million samples can be tested. If that's the mixed sample, then that number will increase. Based on our normal disease prevention control measure, testing is one of the public service available to the public. So for anyone that need to be tested, you can find the testing service, and different localities also provide a better service and improve the efficiency of testing. So far, all the provinces already announced a list of agencies providing 24-hour services of testing, and you always can check all this information online. It's already available to the public at different time periods based on the dimension of needs. We also urge the localities to arrange testing agencies to deal with the change of demand curve. And in terms of the quality management, the national level and provincial level, we have conducted a monitoring at the laboratory level, and also the results of all these, the investigation also open to the public. Regarding the fee charge for the public agency, based on our preliminary research, around that 31 provinces, per person per tube, fee is around 39 RMB. If a mixed sample testing, then the fee is less than 10 RMB. Thank you. One last question, please.
谢谢您的问题。就到目前为止呢，全球已经接种新冠疫苗超过了1亿剂次，我国接种呢也超过了30亿剂。
Sounds Metropolitan newspaper. Now my question regarding the vaccination, the vaccine specific to deal with Omicron. Thank you for your question.
奥密克戎引发肺炎的和重症的风险。那么加强免疫
More than 10 billion doses have been administered worldwide.
还能进一步降低 克隆毒株引起的这个
And also
突破感染
the
力，
vaccines
也就是说，
actually
打完苗
already
以后会
shown
被感染的
that's
情
the
况。
a good effect to deal with the
从另一
Omicron
方面来讲呢，
variant.
为了做到有备无患，我们国家呢已经部署了疫苗研发单位开展奥密克戎变异株的疫苗研发。一是呢，开展了这个针对奥密克戎株的
So
灭活
we
疫苗
talk
的
about
研发。
vaccination
那么这些研
can
究呢，已经
not
临床
only
前
help
的
to
工作
lower
都
the
已经
rate
结束，
of
已经
a
把
severe
资料报到
situation
国家药监局，
as well as the
正在
rate of
进行这
infection
个临
and
床
also
试验
can
的
help to lower the rate of
二是呢，针
breakthrough
对
cases, which means that the
毒
people
株的
received
广
the
谱或
2
者多价的
doses
疫苗
but
研究
still
呢，也进行了部署。
infected.
那么这部分
Right now, regarding the vaccination research
药审中心呢，提供了滚动提交了这个临
designated for Omicron, right now the ODA clinical work
针对
have
奥密克戎
been
毒株
finished.
腺病毒载体疫苗和 DNA
And
疫苗
for
的这个研
the
发。
protein
那么这些呢，已经完成了
research
动物的有效性和安全性试验，正在申报临床。第四呢，就是国
also
家的有关机构呢，
hand
也
in
已
the
经完成
report.
了对这种新的变异株疫苗研
And
发和评
mRNA
价
and
的
the
指导
DNA
原则，
vaccine
并且采取了点对点
dealing
的
with
方式下发
Omicron
到
right
疫
now
苗研发
is
企业，
finished the
以促进
a
这
testing
个
on
研发
animals
工作的进程。
in terms of
即便呢，
checking
病毒出现了更
effectiveness
加
and
严重
safety.
的变异，比如说完全逃逸了目前生产的疫苗的这
And we
个
also
预防
released
作
the
用，
guideline and the policies
我国
regarding
也
the
可
a
以迅速
vaccination
的大规模生产出新
for
的疫苗。
Omicron,
所以这
and
呢
also
这
released
个
the
公众
a
是可
relevant
以放心
information
的。
to
另外呢，
the
我在
vaccine
刚才那个
companies.
没有太这个听清楚，就关于这个
We
新冠
talk
免疫
about
的安
that
全性
if the a variant or
我
new
们说一般
variant
针对常规的这个
run away from the
这个容易
existing
对付的病毒
vaccine,
呢，
then
我们是
we
单
still
一
have
疫苗
that
这个使
capability
用，
to produce
但是对于一些变异性
massive
毒
vaccines
就是
to deal with the
这个
new
病毒呢
variant.
经常是采用的方式。那么对它的这个这两个目的，一个呢是不同疫苗之间，
For the a
另外呢，
regular
我们
or
每个人的体质不一
normal
样，可能对某一类疫苗副作用
variant
多一
or
些。
disease,
你要是经常加强了打，
actually
那
we
那你
just
就
use
这个副
the
作用会加重。所以说这样我们就把一个疫
homologous
苗呢可以规避这个
vaccination.
这
But
个
for
副反
a
应。
virus that very complicated
我们
like
国家采用了
COVID-19,
刚才几
then
位
we
这个专
carry
家和
out
这个
sequential
部里面同志都介
vaccination.
绍
And also we talk
我们
about the
是在两
vaccination
类疫苗的
that's
基础
still
上
the
来
a
进行不同
case
技
by
术为
case.
限的
So
疫
we
苗
talk
序冠
about
的
if
这样一个
one
工作
person
有
that
序
have
进行
quite
的。
strong
那么它的我们的基
adverse
础苗主要
effect
是灭活疫苗。
to
那
one
么我们
vaccination
既可以用
or
灭活
one
苗的同源加
approach-based
强，
vaccination,
那么
then
也
these
可以
group of
用
people are very
腺病
good
毒载
to
体疫苗
receive
和
the
蛋白
a
疫苗的
vaccination
这
from
个
other
疫苗的这
technology.
个序冠加强免疫。那么首先它的安全性的把握
We
是
talk
我
about
们
the
两类疫
base
苗
vaccine
都
is
是
the
在
an active
几
vaccine.
十亿剂次
So we
的
can
这个
use
使
the
用当
a
中是灭
same
活疫苗正式的
inactive
安全。
vaccination
然
as
后另外
booster,
两种苗
but
在
we
几千
also
万
can
上亿
use
的
the
剂次
a
的使用当
sequential
中也
vaccination
充分证实了它
from
的安全。
mRNA,
那么国际上，刚才几位同志介绍了，
but
那么世卫组织还有这个
first
一
and
些
foremost,
欧美的国家，那么他们开展
that
了
should
大
all
量
approved
的这个序冠疫苗
safety
接
and
种的这个
effectiveness.
大量的试验，包括在这个我们国家的灭活疫苗加大
And internationally,
腺病毒载
like
体疫苗
World Health Organization
加大蛋白疫苗
and the European
或者
and American
加大
countries,
mRNA
they
都
already
有，也有倒过来，就是在
conducted
mRNA 疫苗。
a large number of
那么这些研究的结
research
果呢，看
and
到都是安全的。
experiment on
那么它的前
sequential
提也跟我们国
vaccination.
家一样，你首先就单独使用的疫苗的安全性是有保障的。那么在我们国家呢，已
And
经
for
开展了
us,
国家已经
we
前期组织了这方面的研究工作，
Also
包括在灭活疫
conducted
苗基础上打
the
这个
research
腺病毒载
on
体疫苗
the
作为医院
mRNA
的序冠加强，还有用这个蛋白疫苗作为医院的序冠加强。 那么我们看到的它的
research
免疫原性的结果都是非常好的
on
抗
top
体都
of
是
the
100%
inactive
然后它的综合剂
vaccine.
度也能提得更高。那么
And
可以
also
起
we
到这个
conducted
优势互补的作
that
用。
you received
同时呢，
that
它
the
的
inactive
副作
vaccine
用
and also
跟它
for
单独使
booster
用
you
的
can
话是
receive the
同样或者
adenovirus
是更低，没
vector
有说看
vaccine.
到额
So
外
that's
的
the sequential
这个医院习
vaccination.
惯的这个更多的这个副作用
So
反
the
应，
sequential
没有
vaccination or
说它也
sequential
是这个安
immunization
全的。所以从这个意
show
义
a
上来
really
讲
good results.
我们现在在有序
So
的
the
开展的这个
different
工作，
the
它既
technology-based vaccination
是
showed
安全的
very
也
high
是在国内外都显示了它的这个效果。
complementary,
所以这样一个
and
工
we're
作
not
就为
really
我
seen
们原有的这个
the
疫苗
a
的
strong
免疫屏障的建立提供了一个新的手
adverse
段，
effect.
那么使得我们的这个疫苗建立的这个免疫屏障会更加牢固，更加
So
持久。
we're talking about
好，谢
sequential
谢。
vaccines right
好
now.
谢谢
It's
今
working,
天的
and
发
a
布
lot
会
of
几
cases
位嘉宾
in
为我
China
们
and
介绍
also
了近期疫
in
情
other
防控的
countries
相关
all
情
show
况
that
和疫苗
this
接种
is
的有关
a
情况。后
additional
续呢，我们还
weapon
将
for us
继续的
to
召开
deal
新闻
with
发布会。
COVID-19,
也
so
再
we
次地
can
感谢
build
各位
a
嘉宾。
solid and strong wall
今天的发布会
against
到此结束，谢
coronavirus.
谢大家。
Thank you.